Hi, and welcome to the holiday edition of the Vet Dental Show. I'm Brett Beckman. I'm a board-certified veterinary dentist, and I want to welcome you just before the holidays to take in some not-so-common knowledge that should be, and we should be using this in our practice every day. Many of you are, many of you may not be. So if you're not, this is definitely an actionable step that you should incorporate into your practice immediately. If you are using it, congratulations. Here's a review on how it should be done and done correctly. So imagine that you're looking at a maxillary canine tooth. You've got the tooth, you've got that big zone of attached gingiva just above the tooth, and then above that you have a line that separates that attached gingiva with the unattached gingiva, which is dorsal to it. And then at the base of that attached gingiva, close to the crown of the tooth, is your sulcus, or your periodontal pocket, or your normal pocket, or your periodontal pocket if it's abnormal. And then imagine placing your probe in that pocket, in a normal pocket where there's no changes, and that may go 2, 3, 4 millimeters, depending on how wide that attached gingiva is and what tooth it is. But that really doesn't matter as much as if you pass it and there's no bleeding, then that's a normal pocket. But if you pass it, regardless of how deep that pocket is, and it bleeds, that tells you that there's granulation tissue in the base of that pocket, and it tells you that there's granulation tissue lining that pocket, which is normally lined by gum tissue, the same tissue that is the attached gingiva. So when periodontal disease steps in and those gram-negative anaerobes start to cause inflammation in that pocket, the base of the pocket, which is what attaches the tooth to the bone or the junctional epithelium, starts to get inflamed, and it turns into inflamed granulation tissue. And the same thing happens on the lining of that pocket. If we leave that and just clean the tooth and clean under the gum, and we don't do anything to alter that granulation tissue, when we come back in 6 months, 12 months, that pocket's going to be deeper. And eventually it's going to reach beyond that mucogingival line. And once it does, that becomes an extraction. So we want to stop that. We want to stop it in its tracks ahead of time. And we have plenty of opportunity to do that in many of our patients that we see in our general practice, especially those small breed dogs, 20 pounds or less. And it gets worse as we get down in poundage, if you will, if that's a word. So 10-pound dogs, worse, 5-pound dogs, even worse. And those changes can happen as early as a year of age or even earlier in some of those smaller breeds. So we want to be watching for that. We want to be probing and checking pocket depths, and more specifically, not just depth, but we want to find out, is that a bleeding pocket? If it is, it's abnormal, and we need to clean it out. If we clean it out, we can expect that tissue that is in the sulcus will reattach to the bone, and that gum tissue will reestablish as epithelium, whereas now in an abnormal pocket, it's granulation tissue. The epithelium has been eroded away. So we want that reestablishment of that normal epithelium there so that it can reattach. And where we had a 5-millimeter pocket before that bled, when we come back, hopefully we'll have a 2 or 3 millimeter pocket that doesn't bleed. And that's what we're after as far as preventing the progression and actually going back to where we were previously and reestablishing that normalcy with a normal pocket that is less in depth than the abnormal pocket. That all prevents that progression to bone loss. In order to do that, what we need to do is use our periodontal curette. And that periodontal curette has a blade that is sharp on only one edge, and it has the mirror blade on the other end of the instrument. I know that you all have that instrument in your practice. It may be in a drawer collecting dust and hasn't been used in years, and it could be where it's as dull as a butter knife. And that's not too uncommon based on the input we get from our live courses, that they don't use them, or they don't know how to use them, and they don't know the effect of the end use of that and how effective that is at preventing the progression of periodontal disease. So if you have that, get it out of that drawer. If you're not using it, get a dental hygienist that knows how to sharpen instruments to sharpen that, and hopefully that hygienist can show your staff how to sharpen that instrument and other instruments correctly and get started on the right track. This is an action step for this week. Get that instrument, find it, and get it sharpened so that you can start using it and preventing the progression on these patients rather than getting them back and having to extract teeth 6 months, 12 months, 2 years later that could have been prevented with just that one little hand instrument. So the way to determine which edge of each side of that instrument is the correct edge, you just hold that instrument vertically with the toe of that instrument facing you. And you'll notice that there's an angle to that blade. And that angle is either to the left where it's lower on the left, or it's going to be to the right where it's lower on the right. Whichever side that is that's lower, that's the cutting edge for that side of that instrument. The opposite is true if you flip that instrument around, the opposite is true for the other. Many of you can visualize that, so you know that there is only one side that cuts, and it's always the lower side as you look at the toe. That's the side that you want to put on the root when you're cleaning the root adjacent to that granulation tissue, and that is the side that you want to use against the granulation tissue in the pocket at the base, and also to scrape the lining of that pocket to free it of that granulation tissue and expose the connective tissue underneath so that connective tissue can reattach. So that instrument is used primarily for that, and the term that you use that you can apply to that, and also that I would strongly recommend you immediately put into your dentistry service sheet and charge for it, is called closed root planing. And so with closed root planing, what we're doing is we're root planing by scraping the diseased cementum or the calculus or debris, plaque, whatever's in that sulcus adjacent to the tooth. We're scraping that out with the sharp edge against the tooth side, and then we're using the sharp edge against the tissue, which is called subgingival curettage. So closed root planing consists of root planing and subgingival curettage. So I would suggest you put that in your fee sheet. Most people charge $8 to $20 for that procedure per tooth. So that alone will provide a tremendous increase in the quality of your dentistry service. It will definitely pay for itself very quickly with charging for those procedures, and it'll benefit the patient tremendously going forward. So take those with you. Use those as our holiday gift. Incorporate them into your practice, and that gift is for your patients and for your clients. And they will thank you for that preemptive type of approach so that extractions down the road become minimal to non-existent. So again, welcome to the holiday show. We're so glad to have you. If you've been here before, congratulations for being able to view all the episodes that we've been able to do so far. If you're new and have not seen this before, welcome. We do this every week. We'll provide different vet dentistry team nuggets for you to incorporate into your practice. So have a safe holiday, and we will see you next week. Take care.